Hello class, my name is Kelly Jean Mild. This week, I would like to discuss clinical prevention and population health and its importance as a BSN essential. When we think of the future of healthcare, we see that it relies on how we support the whole picture of an individual's health and well-being. We, as healthcare providers, can accomplish this by focusing on empowering a population to emphasize prevention and education, rather than simply treating a disease process that has already occurred. It is easy to see why this topic is an integral element of the baccalaureate education of professional nursing practice. So how does one implement clinical prevention and population health in their practice? I thought we could turn to an example that is currently impacting healthcare. In California, the maternal mortality rate is lower than the rest of America. In fact, according to a study done by McDorman, McClarick, Cabral, and Morton, 48 states from 2000 to 2014 have increased maternal mortality. One of the states left out was California. Why? Well, it had a declining trend. While I discovered this information, it led me to more questions. Why was it lower, and how were they doing it? I looked at California's Maternal Quality Care Collaboration. It is an initiative to make births safer for moms in the state. They developed a committee, one that reviewed how every mother had died over the previous 5 years. One thing that they found was that there were two main preventable complications: hemorrhage and preeclampsia. From that knowledge, they started moving forward. They started viewing every woman as an at-risk pregnancy and initiated protocols for the worst outcomes. They practiced mock codes and teamwork. They created carts, not very different from crash carts, that were specifically designed to prevent maternal deterioration. They focused on education for hospitals and patients. One topic of education they focused on was preventing C-sections not medically necessary, where they found that increased C-section rates led to an increase in placenta acerta, thus increasing risk for maternal hemorrhage. Along with education and protocols to increase prevention, it is important to look at social determinants. California has a method for doing that as well, using the protocol PREPARE. PREPARE means protocols for responding to assessing patients' assets, risks, and experiences. This tool allows patients and healthcare providers to determine what could create barriers to care. Things such as culture, home dynamics, income, education, and community are included in this assessment. This example of how California is handling maternal mortality really encompasses clinical prevention and health promotion. We saw the use of evidence-based practice to establish protocols, educate, prevent medical complications, and improve patient outcomes. We also saw a way to assess social determinants and see how those barriers could affect a patient's care. I hope this video helped you better implement clinical prevention and health promotion in your practice.